Hello, I am Dr. Indira Venkataraman, Specialist Obstetrician and Gynaecologist at Aster Clinic, Muteena, Deira, Dubai. Today, I will be highlighting a few points on PCOS, that is Polycystic Ovarian Syndrome, commonly addressed as PCOS, from adolescent to menopause. What is PCOS? PCOS is a disorder where there is an imbalance of the female reproductive hormones and there is an excess of the male hormone, that is androgen. Every month there is a follicle developing with an egg which matures like a normal woman, but it stops halfway through and becomes a cyst. These cysts are arranged on the periphery of the ovary like a necklace pattern, and this is what is called the polycystic ovaries. These cysts are benign and they are not tumors, they are not cancerous, but these are the cause of the hormonal imbalance which causes all the symptoms like menstrual irregularities, difficulty in getting pregnant, and other altering the appearance of a woman like hirsutism, that is the male distribution of hair, acne, thinning of hair, which causes embarrassment, and it also causes it has the long-term effects. If these symptoms are not taken care of at an early stage, they can lead to long-term sequelae, that is the metabolic syndrome like diabetes, hypertension, cardiovascular symptoms, and sometimes even endometrial carcinoma. So if this is detected early and taken care of, the long-term sequelae can be brought under control and even prevented. Now, how common is PCO? Unfortunately, the incidence of PCOS is on the rise at an alarming rate. We are seeing it is about 1 in 10 women have PCOS. The incidence of PCOS is on the increase in the adolescent age group. What is the reason for this? It is because of the modern lifestyle in a modern day society, involving in a lot of junk food and processed foods, lack of exercise due to academic pressure, overindulgence in electronic media and the social media, competitive world and the struggle in that, and lack of motivation. Over and above, the genetic factor and environmental factors are also there. PCOS can affect any age group. It actually is being called the thief of womanhood. It is a spectrum. It is continuous, which starts from the early prepubertal years to beyond the menopause, but it peaks at the second and the third decade of life, but it affects all ages. It is not a disease but a syndrome with varied presentations. Now, what causes PCOS? The cause is not fully understood, but genetic factor has been implicated, and in these women there is increase of the male hormone, so there is a male distribution of hair. Another factor is the insulin resistance. These women have increased insulin in their body and it does not work properly, so which again increases the androgens and which again causes the symptoms. Now, how do I know I have PCOS? You have to meet your doctor whenever you have any symptoms. The doctor will take a detailed history from you. Your BMI will be measured, your blood pressure will be taken, your waist circumference will be taken, and to confirm whether you have polycystic ovaries, an ultrasound examination will be done to check for the polycystic ovaries, and a few hormone tests will be done to confirm the diagnosis. It is not a single test, it is a few tests which have to be done to confirm that you have polycystic ovaries. Now, how do I get treated for PCOS? The treatment of PCOS depends on the symptoms and the age. It is tailor-made to the age of the patient, the symptoms with which the patient comes with, and what her requirement is. Now, at the adolescent age, the requirement is different. She is very worried about her appearance and not about getting pregnant. Whereas in the reproductive age group, she is worried about getting pregnant. And in the older age, they are worried about the metabolic syndrome. So we have to tailor-make the treatment to the requirement of the patient. Most important is the lifestyle changes, which is mainly the diet and exercise. You have to avoid junk food, processed foods, foods which are rich in sugars. Go in more for whole meal cereals, fruits, vegetables, and lean meat. And there is no compromise on exercise. The other drugs which are used are the oral contraceptive pills to regularize the period, and few other drugs like metformin, and if the woman wants to get pregnant, fertility drugs are used. And in some patients where they don't respond to any treatment, so laparoscopic ovarian drilling can be done to reduce the size of the ovaries, so the woman can ovulate spontaneously, or she can respond to the treatment. Does PCOS put women at risk of long-term complications? Yes. If PCOS is brought under control at a young age, these symptoms can be brought under control or even prevented. So what are these? This is called the metabolic syndrome. So at the menopause time or even earlier, the woman can have diabetes. She's more prone for diabetes, hypertension, dyslipidemia, that is decrease in the good cholesterol and an increase in the bad cholesterol, heart disease, endometrial carcinoma, and some of them have sleep apnea. When they are sleeping, suddenly they stop breathing. So all these can be brought under control. Now the question is, a person is worried, I have PCOS. What can I do to prevent complications? Yes. This can be, first is the awareness of the disease. Two is, once it is diagnosed, try to get control over the symptoms at a very young, in the early stage itself. PCOS does not mean getting treated only to get pregnant, because it affects the other systems also. Get yourself checked regularly for sugars. Complications can be prevented by eating right, exercising adequately, and maintaining the body mass index, and non-smoking, and regular follow-up with the doctor as we grow old for the metabolic syndrome. I would like to conclude by saying that PCOS cannot be cured, but it can definitely be brought under control. 50% of them by simple weight reduction. If a woman with PCOS loses about even 5 to 7% of her body weight, her symptoms, her menstrual cycles will get regular, she will ovulate, conception can happen naturally. PCOS is considered the thief of womanhood, and it has to be addressed at all ages, and it has to be treated. Awareness is most important. Once awareness is there, the rest of it is in our control. As a clinician, we can only diagnose, we can do tests, we can give only medication. But from your side, If you are able to take control of your weight and help the clinician, the response to treatment is going to be better, and the quality of life as we age is going to be better. Thank you.